Welcome back. We've been talking with Pamela, who is a certified dementia practitioner and certified positive approach to care, or PAC trainer. Through Mountain Pacific, Pamela offers PAC training to nursing homes across Montana. Broadwater Health Center Nursing Home in Townsend, now a 5-star facility, has taken advantage of PAC training twice and has seen a tremendous difference in resident care. Rachel Smith, an occupational therapist with Broadwater, joins us now to talk with us a little bit about dementia care. Thanks for being here, Rachel.
Thanks for having me.
Before we talk to you, though, I do want to ask Pamela really quick, can you give us an overview of what is positive approach to care, or PAC?
So positive approach to care it's just really a neat thing, and it's just the positive approach. Now, remember in the last segment, I said that we retain on the right. What positive approach to care says is we need to focus on what they have left. What's gone is gone. Once the milk is spilt, we can't put it back in the cup. So the word remember, it's gone. We don't use it. And what we do is we focus on the positive. So if I were a positive approach to care trainer, which I am, and I'd go out and I would be training in facilities, I would teach the positive approach. One of the things is, if I'm approaching her, I want to make sure she can see me. Remember, the understanding isn't there, so I want to be sure I give a lot of good visuals. So I want to approach from a direction where I know she sees me coming. I want to be sure that I'm very respectful of her and her space, because we're trying to encourage keeping their dignity. So once I get about a double arm's length away, so her arm's length and my arm's length, I want to pause. I want to make sure that she's seeing me. I want to greet her friendly and say, "Hi, Rachel." If I think there's a chance that she may not remember my name, I don't want to put her in the position of getting stressed out and trying to remember. So I'm going to say, "Hi, Rachel, it's Pamela." I'm going to get my hand where she can see it. And I'm going to reach out like a handshake, because that's how we greet each other socially, and that social part of our brain stays intact. Now, what I'm doing is I'm actually touching this part of my hand, the palm, and the palm of hers. And when you hold that way and you let their hand rest on top, that's comforting for people. So even someone who's just stressing out, you can just hold their hand, and if you'd like, you can cup the other hand over the top. And just touching someone in this manner will calm them down and make them feel comfortable. The other thing that we do that's a positive approach is when caregivers are taught how to feed someone, and that's a big thing. We don't think of ourselves as caregivers, because giving means we're doing to someone, and care partner means we're doing with. So as a caregiver, I would be taught to sit across from someone, and if I were feeding them, to take a spoon and poke it at her. And her reaction to my behavior, we call it their behaviors, but actually it's my behavior that caused it, is she's going to jerk back, or maybe she's going to hit my food away, or she's going to toss the food. So that's how we feed children. We never want to not give people respect and dignity. So what I would do as a care partner, because I'm doing with and not to, is I would get in this handhold. I would use what's called my skill fingers. I would sit down beside her. Can you just switch in a little bit? Thank you. And if her food were in front of her, which it would be, I would use her hand and do this. Now what's happening is her mouth automatically opens, because her hand, her body, is both sending and receiving. And when her brain is sending and receiving, her mouth knows, oh, I'm getting food. I should be opening. So we tap into that motor memory, and when it comes down, we do this. And then the other thing that's really neat is once we get that motor memory going, I can take this and I can let her hold the spoon, and then I can just guide, and then eventually, hopefully, I can let go and she can completely self-feed. And that's what we're trying to do, is we're trying to build and maintain dignity. Now, a lot of people say, well, somebody with dementia, it's just like taking care of a child, right? No, it's not. And it really, it saddens me when I hear people say that, because children don't have the years that they've acquired knowledge and all of that dignity and respect that's deserved. And so what positive approach to care does is it tries to say, how can we bring their dignity back to them in everything that we do? And how can we focus on what's left to get the best out of it?
So Rachel, you've taken part in some positive approach
I
to
have.
care. Can you give us an overview on what you've seen with using this approach with people you work with?
The people that I work with they vary, the levels of dementia that they have. So it's nice to see the people my coworkers use these skills and techniques to bring back the dignity in it. And you can see it in the dining room and in the facility, everywhere. It's just wonderful to see that.
And so how does it make you feel as a care partner to be using these approaches?
I'm more confident in who I am and my skill level. I have a lot more knowledge and skill. I've never met a stranger when I have these skills. It's like you don't even know them personally, but when you approach them, you don't have that fear or that insecurity, and you feel confident in the skills that you'll be able to help them.
And Pamela, I know this is kind of a personal topic for you. Can you talk a little bit about why the positive approach to care is so important to you?
My father had vascular dementia, and as much as I loved my father and my family loved him, and we tried to do everything right, we made a lot of mistakes. And because of those mistakes, we missed out on a lot of opportunities, and we lost a lot of joy. And so that drove my passion to learn about and teach and help train others.
Okay, great. Thank you so much, ladies. We'll be right back after this. We're going to talk some more about dementia care and what you can do to help your loved ones if you think they're having any issues with dementia or other categories of this disease. We'll be right back.